Thanks.
Yeah. Hi, everyone. I'm Sam Osterhout, the executive producer here at Lincoln Square, and I'm very excited for this conversation. It links together so many things that we've been talking about here at Lincoln Square for a long time, but in a really surprising way. I'm joined by Dr. Gary Slutkin, a physician and epidemiologist who's worked on identifying and combating some of the most serious diseases across the globe, from AIDS to cholera. His new book is The End of Violence: Eliminating the World's Most Dangerous Epidemic. Welcome. Thanks for joining.
Yeah, I'm happy to be with you. Thanks for having me, Sam.
Yeah. You've been talking about this a lot over the years, but your book opens with this kind of striking claim that violence isn't just a metaphor for disease. It actually is a disease. So, can you explain that to our audience who might be hearing this for the first time? Walk through the kind of biology of this. What's actually happening in the brain when someone is infected by violence?
Well, let me take this on the two levels. It's a disease by its definition. In other words, disease is simply something that has very characteristic signs and symptoms. In other words, you can recognize it, and that entity causes or can cause disability and death, what we call in health morbidity and mortality.
Sure.
So it fits. I'm not reclassifying it. I'm just letting it be known. And it's contagious because it causes more of itself. So people who are exposed to violence a lot are more likely to do it, like people who are exposed to flu a lot, or measles, or even COVID or anything. So it's behaving the same way as a disease and as an infectious disease. And the World Health Organization has a division for it, and so does the CDC, Centers for Disease Control, has a division for it. And it's classified as in the International Classification of Diseases. But so what is happening in the brain is one of the most interesting things, is that there are three basic centers that are managing this, and none of them have any real relationship to good and bad or right or wrong or safe or dangerous. They just are operating kind of the way, like your stomach is operating according to the way it operates, and so on. So the first of these is copying. What we've all heard about mirror neurons.
Sure.
So there are mirror neuron networks. There are copying systems in the brain. So we copy many things, whether they're helpful to us or not. And so this is the first of them. This is kind of at the front of the brain. And then there are these two other things that were set up for us evolutionary wise that have helped us, but can get hijacked to go too far. And the first of these is what we know as a pain center. And social pain uses the same center as physical pain.
Wow.
It doesn't tell you where it's coming from, but it's the same emotional set of feelings of terrible, I need to get out of this. I don't want this, and so on. And so so when people are hurt, they've been humiliated, or have a grievance, or have been abused, that it may sit there. And you can feel this for a mass shooter, they have a grievance, or people who are now, expressing violence, what their backgrounds might be. And then there's this whole other system, which is social reward. And it's a dopamine system.
Right.
And so it runs away from pain. It's trying to get out of pain at any cost. And that, towards belonging, towards being loved, towards being recognized. And then it can go too far. It can go towards needing power. And it can go as far as not just status, but power and cruelty and destruction. And I'm not making up these words.
Right.
And it can become insatiable. And that's what we're seeing now, in fact, in the country with some of the leadership, and the leadership around the leadership, is this system having gone too far?
Yeah, and I want to get to that, the sort of bigger picture here in a minute. But I think it's really compelling to say, to look at this as an actual disease, because it removes the sort of moralizing behind it, but also shows that there are, you can think of someone as being sort of infected with an urge for violence, or a predilection for violence. One of the most provocative parts of the cure violence model is the use of interrupters. So if this is a disease, and you can sort of measure the spread of this disease, as you've shown over the years, then there could be a cure or a treatment, at least, for the disease. So the interrupters are often people, who've been incarcerated themselves, or who are from the community of those who are infected. Can you explain this idea of interrupter, and why does it work, and why does it make so many people in law enforcement uncomfortable, especially?
Well, there's several questions you asked,
A
but
lot. Yeah.
well, the most important aspect of realizing that violence is a contagious process and causes epidemics is that, as you said or implied, that they can be interrupted and they can be stopped by stopping the transmission or stopping the spread. And the way that spread is stopped for every epidemic illness is by finding the people who are spreading it now and preventing them from spreading it to other people. And so, I mean, I ran the tuberculosis program for San Francisco. We would find the people who were coughing the most, who had the most active disorder or disease, and manage them so that they would no longer spread to their family and the other people. And we used health workers who were from the same. If they were from Vietnam, we used Vietnamese people, even in San Francisco and so on. So this is the same story, is that you find people who are most most likely to be doing a shooting, or most likely, you could say, to do a mass shooting,
Right.
or most likely to commit a suicide. To find those people, and then to allow people who have access and trust and credibility with them to interact with them, to cool them down, and to buy time, and to interrupt what was going to or what might have happened. And these are people who have, and when I use these words, access and credibility and trust, they're the people who already know them. We're not like training for trust, we're finding people who are already trusted. So in the world of community violence, it's the world of people who used to be doing this, or who grew up with them,
Right.
came from the same groups and so on, but are on this side of the line now.
Yeah, everyone, if you're just joining us, I'm with Dr. Gary Slutkin, the author of the new book, The End of Violence: Eliminating the World's Most Dangerous Epidemic. And along those lines, regardless of political affiliation, we're this kind of rough and tumble society that prides itself on being, quote, tough on crime. And I know Trump just said the Pope was not tough enough on crime, which is a kind of ridiculous statement. But if in the analogy of tuberculosis, if you are putting a tuberculosis patient in isolation with other people, then that tuberculosis spreads. That also means that being tough on violence in our society means incarceration first, force-based responses. This amplifies the trauma, the retaliation, and definitely the transmission, instead of stopping it. Right, we're putting the people who commit violence in enclosures with other people so that the epidemic can spread. So, what's the remedy? How do we go forward without, a prison seems like an incubator.
Yeah, the prisons are incubators of everything or
Right.
almost everything that is contagious. I mean, COVID spread in prisons, flu
Right.
spreads in prisons, tuberculosis spreads in prisons, AIDS spreads in prisons, and violence spreads in prisons. And then, so, I mean, basically, this is the world of the past.
Right.
This is medieval. This is, we used to put people with, um, where we seem to know better now, with you name it, plague or leprosy or typhus or whatever, and we would see this as these as moral problems,
Right.
that they were bad people, and all kinds of crazy stuff was happening, not just dungeons, but um, you know, throwing widows into the pit or well. I mean, this was the world before we understood those problems. And we now are trying to move out of that world for this problem because we now re-understand it as a process that can be stopped through basically public health and epidemic control measures. And that's what this new workforce, and there's now thousands to tens of thousands of violence interrupters.
Hmm.
So many communities, I mean, there's communities we began working with in the year 2000 that therefore have had violence interrupters for 26 years. So it's normal to have violence interrupters in your neighborhood. And frankly, if you don't, you should reach out to Cure Violence or other community violence interruption services. It's like not having a fire department.
Right, right. I mean, I didn't think of it that way. And how are those um, interrupters doing? I mean, you have real data on
Yeah.
the results, right?
Well, Cure Violence's work has been in over 60 cities in over 20 countries. And there's over a dozen cities now, not just communities, that are at record lows or 60-year lows
Mhm.
using this approach. And it isn't just interrupters, it's also community responses. There's a whole set of things that are put into place to stop an epidemic from continuing.
Right.
But in short, it's very usual to get 50 to 70 or 80% drops of shootings and killings. There's over 25 communities now in 14 or 15 cities that have gone to zero for a year to 3 years, including
Wow.
in Latin America. In fact, there are communities in Colombia and Mexico and Honduras that have gone down between 70 and 90%. And here I'm talking about cartels.
Hmm.
In fact, the most violent city in the world in 2014, which was in Honduras, was dropped 90% in the first
Wow.
2 years. And it's now like the 43rd most violent. This is a city that had 10 times the rate of violence as Chicago, not twice, 10 times. And
Wow.
it was dropped 90% because there's basically people don't really want to do violence.
Hmm.
They're just kind of off the hook, is what some other people call it. They're just off the hook. And they just need the right people to talk with them and cool them down and to buy time, shift their perspective, then stay with them. So there's a protocol for this, and there's serious professional training on how to do this.
So I want to kind of turn a little bit then, because there is, there's violence, as we've seen, that is broader and more insidious than street violence. And you say that political assassinations, authoritarian leaders directing violence against their own citizens, and even war that seems to be spreading right now are all syndromes of this disease. Are we living through an outbreak right now?
We're living through an outbreak would be a small word for
Huh.
what we're living, but it works. It is correct. It's a correct word. We're actually in a rather not so early phase of pandemic violence.
Wow.
But in terms of this country, you can't say one country has pandemic, but it's just there's so many spots globally. But to where your starting point in this good question is that So there's many different types, but we do use the word syndrome
Mhm.
of violence because these different types, they cause each other, so
Right.
but let's just talk about what you were really aiming for is authoritarian violence.
Yes.
So authoritarian violence is a very specific syndrome and the worst case, because even genocide comes from it and war comes from it.
Right.
And we're seeing now in this country violence happening in multiple directions at the same time. I mean, not only the war, the obvious war in Iran, and all of it spread. You can see it spread into all these other Gulf countries and even into Turkey and so on. But also that there were 7 or 8 other countries that were bombed last year by this administration. But the violence is also obviously coming into the country. So this is what happens with authoritarianism too, and so we're seeing this with the ICE behaviors, which are violent behaviors. We're seeing this with the number of people who have been killed or died in these deportation camps and so on. We're seeing it also in deprivation. So if it's worthwhile to look at the WHO definition of violence. It includes deprivation. Stalin had an enormous deprivation program. So did Mao, of famine of millions, maybe tens of millions. I mean, right now it's projected that there'll be 50,000 excess deaths in the U.S. from the Medicaid cuts and the food cuts. And it's projected that there will be 14 million people dying from the foreign aid cuts to health and food that were made so early on that people have forgotten, and probably 500 or 700,000 already. So all of this and the threat is also so there have been threats from this administration to Canada and Greenland and Mexico.
Exactly.
So all of this is, and what you have here is the spread through so many other people. And these other people have, in a way, a susceptibility. There's been a lot of exposure and a lot of susceptibility, and that's the way infectious diseases work. A lot of exposure, and then how strong or weak are you in your body or in your mind to resist it?
So, I mean, in this case, authoritarian violence disorder, Trump himself is a super spreader. And, I'm curious, when the head of a country with the sort of biggest platform on earth is spreading this syndrome, how do we stop that? How do we disrupt someone like Donald Trump?
Well, there's playbooks for this, and there's the epidemic playbook, and they overlap a lot.
Interesting.
So, in fact, for example, what we in public health call community responses. They're the first pilot that we did in West Garfield Park. We didn't even have interrupters. We primarily had public education, signage, and community objecting every single time there was a shooting. So the pushback through community responses, which are called protests in this realm, are enormous. They need to be continuous and intensive, and the amount of it is highly relevant. At the same time, there needs to be interruption at all of the points. And so that means, where there is force being used with cruelty and violence in neighborhoods. And, so we kind of overlap with the legal system here because we do all of this in a legal way.
Sure.
But, two the point of the largest spreaders, what we do in epidemic control is we do what we can to contain it.
Mm-hmm.
I mean, there are things to do to reduce its infectivity by reducing its effect, but nothing reduces its infectivity as much as stopping the exposure. And so you yourself can remove yourself from being exposed, but I'll just give you these kinds of historic examples, not in the political or history, but in epidemiology. I mean, this is why the pump was removed from, the handle was removed from the pump in London when it was spewing cholera throughout the city.
Right.
It was thought to be a good measure to remove the handle to reduce the spread, so to stop the spread. Likewise, Typhoid Mary was isolated.
Right.
Because why? Not to punish her, for the health and safety of the public. I myself have temporarily isolated or contained 5 people who had active tuberculosis, same reason, but not for punishment, because they were a danger to the health and safety. So there is good reason to attempt to contain the major sources of spread of violence.
Back in March, Defense Secretary Pete Hegseth hosted a Christian worship service inside the Pentagon. He does every week. And he said, he prayed, "Let every round find its mark against our enemies of righteousness and our great nation." And he also prayed for overwhelming violence of action against those who deserve no mercy. This is through your epidemiological lens. How damaging is a prayer like that in a place like the Pentagon? I mean, this is clearly a transmission event, right?
Yeah, it's more than that. So when I was researching for this book, I learned so much in the writing of the book, The End of Violence. I mean, I knew 25 years ago that violence was contagious,
Mm-hmm.
and that it behaved as a disease. And we tried to prove that that we could stop it. And we did this in so many places with 20 studies and all kinds of. And then I had to understand how this worked. But I then began to explore, because I'm not leading the organization anymore. Monique Williams is. And in order to work on war and tyranny. And I fairly recently, in the writing of the book, learned that there were a lot of war scholars who had been studying war and who had come up with the idea themselves that violence was a disease, and that it was an epidemic, and there was epidemic disease, and that we should look to public health and epidemiology for ways to manage this. But in the context of these historians, there was one, I think his name is Professor Fox, who did the math on violence that was religious. And it was worse. It was more contagious and more lethal. And furthermore, extraordinary, what is called religiosity, is a greater susceptibility, if you're exposed, to then do it. So not everyone who's exposed, I mean, I could watch a lot of these rallies and probably still have resistance, immunity to it, but it's an additional susceptibility that's being bred. So this religion, in the context of violence, is way more dangerous.
Wow, it's a more dangerous strain of violence. And so, when you look at someone like Hegseth, you can assume that he has also been infected by violence, and now he's become his own sort of super spreader.
I don't see him as well.
No, he doesn't seem well.
Right. I don't see him as well. And a number of these people, I don't see them as well. This is not a diagnosis matter. This is the way that violence affects people as an illness. And this is, there's low grade, and then there's more serious grades, like as for any illness or disorder or disease.
Sure. So, you've spent, as you said, decades in places that have lived through political violence, like Uganda and Somalia, and you've talked about Honduras, Iraq. When you look at the United States right now, where are we in that sort of spectrum? And is there anything from those experiences abroad that tells us how we come back from where we are currently?
Well, there's the stopping and there's the coming back.
Right.
So we have a lot going for us in this country, because there is somewhat of a moral frame in the background, and people don't want violence. I think what we're largely missing is understanding this.
Mm-hmm.
We're seeing this as politics, and it's violence.
Yeah.
So now, in terms of how to approach this, I think that these interrupters, or people talking with people who can do more interruption, there has to be more conversation with some of the people who are resisting their potential roles in the containment. And that some of those are legislators.
Yeah.
But where are we here in this country? We're at an early stage fast, but we're responding very fast. Minneapolis is a fabulous example of that, and there's been pushback now, which is important for authoritarianism and for bullies. These are overlapping syndromes.
Sure.
I mean, what you can see in this syndrome is you can see bullying, and you can also see a mass shooting of the whole country not being stopped, with like the people just standing by without stopping it.
Right.
These are different ways of looking at the same phenomenon. So in the worst case is this becomes a relapse of World War I and World War II, because it is the same. It's it's the same syndrome. Authoritarian violence disorder has relapsed historically, but the country is waking up. So this is up to us to provide enough resistance, enough social disapproval, enough political disapproval. And there are several political leaders who are standing up very well.
Mm-hmm.
And they need to now show the new way, as well as interrupting the old way. And that will come from what the people really do approve of and want, which is basically a better life, and without the suppression.
Right. And without violence. And, to that end, I just a couple more questions for you. This is so fascinating to me. And I think, there is a lot of literature on the treatment of addiction, for example, as a condition rather than sort of a moral failing, right? And when you put violence also in those terms, then it seems that we can become closer to an actual treatment or a solution when we stop essentially just shrugging our shoulders and saying this person is just defective, that they actually are infected by a disorder. I wonder, though, is there an inoculation? Is there something that we can do in our own lives, or our daily lives, or some way that we can, I guess, bolster our immunity to violence, to this epidemic?
Well, I want to say one thing that you reminded me of is that there is that how it relates to, in a way, drug addiction is that, in a way, some of these people can't help it. The people who are looking at and disliking what they're doing, it isn't sometimes won't, it sometimes can't.
Right.
And so there's an insatiability, a need for more and more power, but also more and more cruelty and more destruction. It's like it's an insatiable, dopamine driven, and loss of empathy and so on. So for personal immunity, that is easier. It's to stay away from the exposure. And for all of us, we really have to see this differently. We have to stop seeing this as politics and seeing this as violence.
Mm-hmm.
I mean, when plague overtook Europe, it wasn't a political matter. COVID kind of took us over for a while.
Sure.
So it's the violence that's going on and the deprivation that we need to be objecting to. So the immunity comes from the whole society rejecting it.
Interesting. It reminds me of anytime I would ever have to go on X or Twitter because of work or anything like that. And not that it was ever something I would really ever want to do, but would need to do to research a guest or something like that. If I accidentally clicked on the wrong tab, my feed was essentially just street fights, right? It was men fighting in the street or in bars, or women pulling each other's hair. It was just a buffet of violence, and it makes you feel ill. It really does. And I feel like X and some social media is that kind of super spreader as well. So it seems like maybe one solution, everyone out there listening, don't go on X, right?
Yeah, we need to also be looking at our information sources as the way we look at air. Is it polluted? Is it clean or dirty air? Is it clean or dirty information? Is it harmful or helpful? Is it healthy or unhealthy? Is it safe or unsafe? This is the lens in which we should be looking at what's going on. And the violence that's going on is obviously unhealthy. But we've had a lot of very healthy responses. And I mean, I look at the judges who are saying no. I look at the legislators who are saying no. I look at Minneapolis, which said no. And look at how the Minneapolis no went into the legislature as a no. And so this, approval and disapproval matter to our minds. We're set up in that way. Not belonging hurts, being disapproved of hurts, belonging feels good. And these are major forces in our mind that either drive us to violence or drive us away from violence. And we see a lot of people going along with for the belonging and to get out of the pain that they have been falsely told is due to somebody else. Or it might be the wrong somebody else. So these are the ways the mind works. But to your large point is we're sitting now in an outbreak, more than an outbreak, a serious situation of the spread of violence through threat, through the use of power, through physical force, through other people accelerating their use of violence, whether it's government people or whether it's lone wolves, as they call them, or militias. And so all of that needs to be pushed back on, said, we don't want this, we don't do this anymore, this isn't us. go away. And I mean, and whatever are the political levers that we need to interact with the people who can interact with the people to stop the spread.
Right. We all become the interrupter of this.
Right. And together we shift the norm.
Mm-hmm.
The norm is what we feel is expected of us. And so, when someone pulls out a gun in a bar and everyone thinks, this is a true story, that now the whole bar is going to get shot up. But instead, so everyone says, wait, what are you thinking? We don't do this anymore. You are shifting the norm.
Wow.
And like even on the street, I keep going back to these ICE things. People were interacting with them saying, what do you tell your kids? What would your mom think of this? We would say this often to people on the street. What would your mom say to you now?
Right.
So there's a lot of scripts and mechanisms. And the book, The End of Violence, has a whole chapter on interruption and how to do it, and where to get the services for your own community. It has a whole chapter on norms that we're now talking about, and how norms get shifted and how they have been shifted. That's how the result in Honduras happened. It's how the result in Chicago happened, along with interrupters. The book also has a whole chapter on what we call infections of the state, including authoritarian violence disorder.
Yeah, I recommend everyone get this book. It reminded me of a few years back, there was a really sort of viral video where a gunman entered a school, and a coach or a principal reached out and sort of drew him in. He saw that he had a gun, and he embraced him, and he just held him like this, and it felt like the sort of most immediate and visceral interruption that you could imagine. Also, obviously, the principal was putting his own life on the line to interrupt this potential violence. I wonder, just one more question, if you have a second. The title of the book, The End of Violence. Violence seems like a condition or a virus that's been with us since the very beginning of humanity. Is there an end to violence, or is there just more suppression of outbreaks?
Well, it's the word elimination has it means the ability to make something go to zero for a sustained period of time, as measles was here.
Sure.
Or to, as smallpox is now, gone completely. That's actually eradication. Or in which case it's no longer a public health threat. And what you're saying is that, what people don't know is that plague shows up every once in a great while, but it's stopped. It's the same thing, Ebola, which we don't hear much about. It shows up now and then in Uganda, but they have a system.
Right.
And they recognize it, and they stop it right away. And that's what's happening in these communities, these now 25 or more communities that are at zero. It may show up as a potential, but because it's like the beginning of a fire, just a little spark, but there's someone there to put it out. So you have the norms, you have the interrupters, you have the system, and the result is years without violence.
It's incredible. And when you look at violence in the way that you're suggesting, then you understand that there is a solution, and you feel less hopeless, and you can put those systems in place to prepare for it.
It's doable. It's
doable.
done. It's being done.
It's being done right now. Dr. Gary Slutkin is a physician and epidemiologist, and his new book is called The End of Violence: Eliminating the World's Most Dangerous Epidemic. Dr. Slutkin, I really appreciate this. This is so fascinating, and everyone really needs to check out this book.
Go to the website. It has my name, and you can order it and also see more about what's in it. So that's just GarySlutkin.com.
Excellent. Thank you for joining today, and I'd love to get you back sometime soon.
I'd love to as well. It was great talking to you.
Good
Thank you.
talking to you. Thank you.
Thanks, Sam.